Biomechanics. A single muscle does not exist in isolation. The large muscles impact the smaller muscles. Think about a time when you might have pulled a lower back muscle or felt tightness in the lumbar region. Had you just stood up from prolonged sitting or twisted quickly while lifting? What other muscle groups were being recruited at the time? While the low back muscles are the ones injured in this scenario, in many ways they are impacted and governed by, among others, the larger and more powerful gluteal muscles that connect along the ischial crest and ilium. When these gluteal muscles, or the associated hamstring muscles, are tight, instead of acting as a shock absorber, they limit SI joint and pelvic motion and apply a counterforce against the low back muscles. During rapid or forceful rotation or bending, these small back muscles cannot overpower the tight and relatively immovable gluteals. As a result, they become overstretched and injured, leading to lumbar muscle strain and potentially deeper injury in the ligaments, joints, or disc. When treating a lumbar injury, then, one must always consider the role that the gluteals, hamstring, and anteriorly the psoas and abdominal musculature play in the injury mechanism and recovery. Joints do not exist in isolation. Muscles attach via tendons to the bones around the joint. Think about a time when you felt sharp wrist pain picking something up. Why did you feel pain in the wrist? When you fully flex your wrist, your forearm flexor muscles contract to move the wrist down while your extensor forearm muscles relax to avoid overly restricting this motion. At extremes of flexion and rotation, the extensor tendons are pulled tight over the top of the wrist. When the extensor forearm muscles are tight, these extensor tendons pull back on the wrist joint instead of stretching or relaxing. This can lead to pain and inflammation at the pinch point of the wrist. When treating a patient with a wrist injury, one should consider and address the degree of tightness in the extensor and flexor forearm. Similarly, when treating a shoulder injury, even in the setting of a rotator cuff tear, addressing the tightness and trigger points in the upper back and trapezius muscles can provide longer-term relief. Why is this? If trapezius or chest wall tightness is limiting shoulder excursions, it will exacerbate any shoulder pathology present. Shoulder range of motion can improve when these muscles relax or loosen. Muscles can cause more than muscle pain. Think about the patient or family member complaining of a headache after prolonged work at a computer workstation or from a stressful workday. While some patients may have a central vascular cause of headache, the vast majority are experiencing referred pain from the neck and jaw and scalp musculature. Treating the headache with medications might help in the short term. Treating the underlying neck and jaw muscular tightness, however, can produce both immediate and long-term dividends. Take time to elicit the mechanism of injury in detail. In what position was the head, shoulder, wrist, back, legs at the time of the lift, reach, or fall injury? Was the patient kneeling while lifting, twisting while squatting, or standing forward flexed? For many slow recovery cases, revisiting the injury mechanism can lead to consideration of other body parts not thought to be involved in the initial injury process.